So I started off as a unit secretary for a university hospital, and at this point, I was dealing with handling patients and the inbound calls, kind of being there for the nurses and relaying information to them as well. And then while I was there in this position, I was reading a newsletter, and I saw this lady on this picture, and she looked like me. And so I was like, I don't know what it is about this lady, but I want to find out who she is and what she does. Something just pulled me to her. I thought I wanted to be just like her. So I reached out to her, and she was a systems director for the HIM department. And at that moment, that's when I began to try to learn more about the HIM field to see what I could do and what it was about. So that's how I learned about health information management. Once I was able to complete my health information management degree and going through that, actually, I worked for a doctor's office. So I worked with the medical records. At this time, we were just transitioning from paper records over to the EHR. So I kind of helped with the implementation of moving those records over from the paper format to the electronic format. So I dealt with that. I also dealt with prior authorizations and did a lot of front desk work. So I was checking in patients. I was calling patients, getting authorizations for procedures they were having done. So I did a little bit of that as well. Upon graduation, I then moved to doing some more kind of patient revenue um, type work, dealing with the authorizations and things like that again. And then I was able to move to release of information. There, I was reviewing the work of other release of information specialists and the releases they were releasing to patients, to healthcare providers, to insurance companies, and making sure that they were following HIPAA guidelines. I did that for a while, which was really good, but I found immediately that repetition really wasn't my thing. So I kind of looked around again. I developed a lot of different relationships with people within the department. The great thing about the department that I was in their organization is that everyone kind of was siloed away from everyone else. And I'm a very people person. I'm very much so a people person. So I would go around and just talk to people. What are you doing? Or what does it look like? So I was learning through osmosis. After that, I kind of moved to a director position, HAM director, for a small hospital where I was in charge of building the facility from the ground up. And because it was a smaller hospital, they did not have to well, they weren't required. They weren't really interested in moving over to the EHR system because it was really small. So everything was paper records. So I had to dealing with the paper records, dealing with accrediting bodies other than Joint Commission. Usually people think about Joint Commission, but there are other accrediting bodies as well. So I had to make sure that my department was created based on those DMV guidelines. After that, I went back to the place shut down, so went to another place. Um, Went back to the previous position, kind of the same position, but it was more of a quality analyst position when I dealt with policies and procedures and also with medical record compliance. I would look at policies and procedures to make sure that they were medically necessary. I would also check to make sure that there was a place in there that talked about how we would review those policies and procedures, making sure that it was clinically necessary, kind of using a bit of my knowledge with medical terminology, pharmacology, things like that. Also, a lot of relationship building. So I really enjoyed that because I was able to speak with different members of the healthcare organization. So in this position, I didn't just speak with people within HIM. I was actually coordinating with the different medical departments. So I was speaking with nurse management, emergency medicine, every single healthcare, I guess, team is the best way you can describe it. I was having those conversations with them. So I was actually learning about the different areas within that position as well. And I really enjoyed that piece of it. I've done some outpatient coding as well. And I found that that was something that was not for me because I'm not really big on repetition. I like being able to interact with people. And that was a position that didn't allow me to do that. So it wasn't the best position, but I learned a lot. And I'm very thankful that I had that opportunity. So from there, after I kind of moved around the different areas of HIM, I really had to sit with myself and think about, what is it that you really want to do? It would have been easy for me to stay stagnant in the position that I was in for such a long period of time because I was making a nice amount of money. But I think takes a lot of self-reflection when you actually realize there is more to life than just getting the money. And I want to be able to be happy. I want to be able to be excited about waking up to go into work every day. What do I need to do to get to that point where I'm excited to go to work every day? But while I was having that internal struggle, I had a lot of people and students that would reach out to me and say, "Wow, you're doing all these things. What is it that I need to do?" So I figured and I saw there is a need for people to know more about these different career avenues within HIM. And I just so happened, because I've been so what's the word, unsatisfied, I guess, within my career life, that I just so happen to know a lot about these different things because I was asking a lot of questions and making a lot of connections with different people and learning about what they do. So based off of my interactions with other people, I was able to guide others in what they may want to consider doing. And so that's kind of how I pivoted into the education aspect of my career now. So I love being able to interact with students. I love being able um, to learn more about them, and based off of what they're telling me, I think that you'll be great here. And so I love being able to do that, and I try to incorporate that in the classroom as much as I can. So the best way I would describe HIM is I like to break it up into 4 parts. Now, of course, there are a lot of different areas within HIM, but I think that whenever you present someone with a lot of different options, it's like analysis paralysis. So how can we make it as simple as possible? So the simplest way to put it is you can divide HIM into 4 categories. You have information governance and compliance, which again deals with those laws, those regulations, privacy, security, things like that falls within that area. You have data analytics. How can we take the data that we are given and how do we use this to apply to either the organization or within these different interdepartmental needs and things like that. You have healthcare informatics. Are we making sure that we are optimizing how we're using the EHR? How are we connected to the health information exchange? Things like that kind of falls into that area. And then you have coding and revenue cycle, which is generally the area that most people hear about when they think about HIM, as they think about coding and revenue cycle. So that includes authorizations, patient check-in, billing, looking at those ICD, HCPCS codes and things like that, I can't even think, CPT codes, all of those different things kind of fall within those areas. So those are 4 areas that you can kind of decide to go in from there. And then once you decide, I really like this area, then that's when you start to do your research and you really dive in and to learn about, okay, if I'm interested in information governance and compliance, what does that consist of? What does this look like? And then that's when you'll kind of find that, of course, there's some intercorrelation between all of the different areas. So I mentioned 4, but even within those silos, those individual parts, you're going to find pieces of that in there because it's all woven together. But maybe you're interested in revenue cycle and coding, but you're also interested in information governance and compliance. So maybe that looks like you would be the one to review those CPT codes annually, or maybe you would be the one to do the audits to make sure that the coders are actually following those guidelines. So that's kind of how you're able to hone in on exactly what it is that you want to do. And I think that's the easiest way to break it down. So if you start big and then go small, it's a lot easier and less overwhelming. Ultimately, you have to remember that it is about serving the community and the patient. So even though you're removed from that and you're not direct, you still have a responsibility to remember that everything that you do affects one person. And so that person could be, my aunt, my cousin, my uncle, and I want them to be able to have the best care that they have. I want their information to be protected, and I want them to have their information transferred to the doctors that are going to review this information to make sure that they're able to get the correct health care applied to their situation. So it's important for us to be able to be put into positions to where or go for positions that we're passionate about. If you're passionate about it, then I know that my uncle is going to get the best health care that he could possibly ever imagine. So you owe it to yourself and you owe it to the patient to make sure that you're doing something that you're absolutely passionate about so they can get the best outcome possible.